What are you in for today, Amanda?
I started noticing some spots on my arms, and I was getting concerned that they might be precancerous.
Okay, well let's talk just for a second about maybe what some of the risk factors might be that would concern me too. First of all, just standing here and looking at you, I can tell your skin's a little bit fair. Notice you've got some blonding hair, but your eyes look awful dark. You don't have the blue or green eyes that we see of folks who tend to have more trouble with their skin. Another risk factor, let me ask you this about your just your habits. Do you use a tanning salon, or do you lay out in the sun much?
I did in the past, I don't anymore.
Okay, so you quit doing that. Good, good. That was a good idea to stop doing that, because we found that tanning salons do, even though they're just using maybe ultraviolet A rays, actually do cause skin cancer. People that use tanning salons actually are twice as likely to develop skin cancers.
Okay.
Now, do you get out in the sun much?
A little bit. Now that summer's kind of ending, not as much.
Yeah, but what do you do? What do you do to protect yourself?
I tend to only use sunblock when I'm sitting at the pool with my kids, but then I don't get in the habit of doing that if I'm just out and about for regular days.
Yeah, you need to at least use a 30 strength oils and creams and all, with a little bit of A blocker in there too.
Okay.
Do you know when the worst time is to be out in the sun?
I think maybe morning?
Well, actually late morning.
Okay.
I always remember it's from 10 o'clock until 4 o'clock. So before then, after then, and if you're ever working in the yard, get you one of those really big fancy hats. So why don't we just take a look? Show me what it is that's concerning you.
I started just having a couple moles pop up, and then some of these white spots. I don't know where the white spots came from.
All right. Well, moles are common. You know, we can actually have up to about 40 moles on our skin, and that's okay. But when we're looking at these, the two things we're kind of, just to make it simple, we classify them into non-melanomas and melanomas. Non-melanomas are the most common types of skin cancer that we see. Those are the ones that pop up and they go away, and they pop up and they go away. They are irritated, they may bleed. That's a bad sign. The two types that we see are basal cells and squamous cell. Now here's the good thing, they can both be treated.
Okay.
Squamous cell rarely will ever metastasize, very rarely. Basal cell will not. But if we can catch them early enough, we can keep them from getting too big. You know, we have about 8,000 people here that die from melanoma.
Oh, wow.
And again, it's from sun exposure, from tanning bed exposure, and those come up and they look really odd. First of all, A stands for asymmetrical.
Okay.
B, borders. Again, if you look at that same mole, the border is nice and round and smooth. I tease people and I say, if you ever have a mole that looks like Italy, we've got a problem. C stands for color. As I look at the moles you've got, they're nice and uniformly brown, they're one color. Melanomas can be all kinds of different colors, black, white, blue, red. And then the D is for diameter. Notice how small those are? If you take an eraser on a pencil, it's about 7 millimeters. If any moles go 7 millimeters or larger, have those looked at. Now, E stands for evolving. If you get something on your skin and it seems to be changing over time, getting larger, getting more irregular, definitely get that looked at.